Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, my name is Betty Sledge, and I'd like to welcome Kim Thatcher, the incumbent Republican candidate running for the State Senate District 11 seat. I'm a member of the Legislature and Advocacy Committee with Northwest Human Services, and we have some important questions regarding older adults that we would like to ask Kim, and she has graciously agreed to answer them. So we're going to get right to it. So welcome, Kim, and thank you so much for the gift of your time.
My pleasure. Thank you for the opportunity.
Okay, so number one, as an incumbent, tell us about the votes and legislation you supported last session that directly benefited seniors and people with disabilities.
Well, excuse me, when doing some research on that, I was looking at the past couple of sessions. The last session was the proverbial short session, and everything's just very, very, very compressed. But there were a couple of bills that I very much supported. One of them passed that I want to mention. This one would establish a senior emergency medical services innovation program in the Department of Human Services, and basically would encourage these local public sector private, or not private, but pilot projects that would help seniors with emergency medical services, especially in light of what happened with COVID and all that. And then there was a couple more that died in Ways and Means. One was, I think, a real important bill that would require the Department of Human Services. It was called House Bill 2595, and it would require the Department of Human Services to conduct staffing and workload analysis, figure out what they need, and then update that if they still needed that in order to serve better our seniors and people with disabilities. And that was related to their biennial budgets. So they would have that built in their budget. And I thought that was a good one. That died. And another one was House Bill 2791. And that would appropriate more money to fund the Department of Human Services for making gateway programs to serve seniors and people with disabilities. And that seemed like a good idea. And then another one that's been around for a little while. It was in the latest one was SJR 11, or Senate Joint Resolution 11. That one died. It's been around for a little while, but it would help seniors with tax relief on their property that they live in to help them stay in their homes. And so I'm actually becoming a chief petitioner for a ballot measure that would put a cap on property taxes while that senior owns that home. And any subsequent seniors that live in the home, so they would have that relief, and then it would reset to the value that it would have been put to had it not had that freeze on it once it's been sold. But it's just so clear that we have such a high cost of living here in Oregon. I think we're ranked number 5 as 5 most expensive for seniors to retire to, and very high cost of living. And then the state on top of it taxes retirement and pension incomes. So there's a huge concern that our senior citizens are not able to safely age in place and afford to be able to stay in their own homes. That's with a recession looming or possibly already here, there's some debate on that. The cost of living is made even more expensive with the accumulation of, in Oregon especially, of the red tape and taxes and unnecessary regulations that hit small businesses. And when that hits the small businesses, it trickles over into our economy. So we're a small business economy, and those costs get passed along, and we all feel it when we go to the store or when we buy gas, or just simply pay our bills for our utilities and all that. So, but seniors get especially hit hard, and they're gouged in their retirement and their high income taxes, gas taxes, the surcharges and all that. And then they're getting stuck with the commercial activities tax costs that came into being during COVID, and all while having higher medical bills and prescription drug costs. And so every year retirement income dwindles because the dollar becomes less and less. In fact, it's happening almost on a daily basis right now. And property taxes keep going up, and it's just not right. So when the next recession hits, we're going to need to be able to help our seniors be able to stay in their homes, and especially because they can't boost their income in the same way that a working age person can, which brings me to another bill. It died in the Committee on Business and Labor. It was House Bill 3277, and it would disallow age discrimination when it comes down to it. In employment practice, a lot of people will look at an older person and say, you're going to be too expensive to insure, or you're going to be too, we don't want you, you're too old. That's just wrong. Can't have that. I think businesses are missing out, number one, by a vast amount of experience and know-how. And I think that having age discrimination law on the books and enforced would be a great thing to do as well.
Okay, thank you so much. Our second question, what have you done to advocate for Oregon Project Independence, or OPI?
I am a huge advocate of Oregon Project Independence, and I miss the days when we met in person and we talked about it. And I remember folks coming into my office, and we would talk about different individuals and how they were each affected by the lack of project independence in their life, or how they were positively impacted simply because of a dividing line on the continuum of care and all those things. But I was directly involved over the past, pretty recently, with a couple who just wanted some help so they could stay in their home. So he did not want to put his wife in a home. She needed a lot of care, and the husband was able to do some, but not a lot, because he himself had a lot of problems and disabilities, but he was unable to take care of his wife full time. So they were having a lot of trouble finding somebody, until eventually the husband became so disabled himself and unable to care for his wife that they were able to get Project Independence in that 24/7 service. It might not have had to have gotten to that point, but at least they were able to obtain those services. So they were facing issues with caregivers, and for various reasons, they were short staffed, and there were mile restrictions and things like that. Now, as far as Oregon Project Independence prioritizing funding, I think you gave me a wonderful little chart here that really shows how much more cost-effective Oregon Project Independence is with this little tiny bar. I don't know if you can see it, but tiny little sliver at the bottom here of the cost versus paying for somebody in a medical home, and then interim expenses, even interim levels of care. But it is so huge of a savings that we have to prioritize funding for the Oregon Project Independence for people that have disabilities as well as seniors. And we need to make sure it's built into our biennial budget. Oftentimes it kind of drops off in the Ways and Means process, or at least gets reduced. And I think we can prioritize a little bit better.
Right. And this third question, Kim, is very much like the second, just not quite specific to the program itself, but how would you prioritize funding for services to an ever expanding population of seniors and people with disabilities?
Well, there was a bill, I think I mentioned it above, that was in 2021. It was House Bill 2595 that would have prioritized funding for seniors and people with disabilities before actually developing the biennial budget, where the Department of Human Services would be looking at their workload and their personnel shortages, perhaps, and building into that budget. So that would do a lot to take care of it, to prioritize that. Yeah, I think that would go a long ways, I think, in trying to assess and better handle the ever expanding population.
Yeah, okay, thank you. The next question is, what will you do on the state level so that seniors and people with disabilities have increased access to affordable housing and appropriate nutrition?
Well, I also kind of alluded earlier to a ballot initiative I'm signing on to as a chief petitioner to freeze taxes. Affordable housing, it's better for a senior to just be able to stay in their own house and not be taxed out of it. And providing that property tax relief would help seniors stay in their homes. And I think this is long overdue. We had a property tax deferral a number of years ago, and then it just kind of dwindled. And I think it's only right that we help seniors with this. And as for nutrition, going back to the couple I was talking about earlier, where the husband had difficulty taking care of his wife, well, they needed help not only shopping for the groceries, the nutrition, but also in preparing the food. So they were fortunate enough to get that help through Project Independence. And I also think it's great when churches get involved in helping seniors in their congregation. They can see what the seniors need. And sometimes the seniors are not able to articulate what they need at some points because of different debilitating conditions. And sometimes it's the families of those who are elderly and disabled that can come to advocate. Either way, it comes down to, when these people are identified as needing services, Project Independence, Oregon Project Independence is a great way to provide those services, but they need the resources to, help out and reach out to and help those that need the help. So I've seen too many people on really poor diets. My grandmother, even though when she could make these decisions herself, she would choose poorly with her diet. She would also choose poorly with her physical activity. And the staff, bless their hearts, they would just let her have her way, but they didn't push back at all and give her any education as to why it would be important for her to keep moving, because eventually she was not able to, very quickly was not able to walk and be mobile. And so I think there needs to be some education of not only the seniors in the nursing homes, but the people taking care of them to help encourage better choices, better dietary choices and physical activity choices. And so then there's also the people that have behavioral health issues and they resist that help. So bringing together the education component is important.
Oh, good. So I'm glad you mentioned behavioral health because that's around the next and the last question that we have for you. What would you do as a legislator to address the behavioral health issues that have been exacerbated by isolation related to the pandemic?
Gosh. Yeah, my grandmother was in a nursing home, and it was a very sad thing because she wasn't the only one going through this. All the people were, but in my grandma's case, she would look forward to seeing family members and friends come and visit her, and she would recognize them. But she did not quite understand why she could not be in her own home in the first place. So she really did look forward to that connection. She had dementia, and so our visits by family, or where she could still recognize us, she would look forward to the next visits and even remember some of the things from the last visit. And then COVID hit, the coronavirus came into play and all the response. And I realized it was a new situation for all of us. And I hope we can learn from some of the mistakes. I think some of the mistakes that were made affected our seniors, and the ability to visit folks in nursing homes when it was denied. I can only imagine the anguish that seniors experienced, the abandonment they must have felt. And I think the mandate to not visit them went on for way too long. And by the time our family was able to visit my grandmother, she was so downhill that she no longer knew any of us. And there's other examples where, a daughter expressed frustration with how her father was cared for or not cared for, that she felt he was being ignored, and that they need better training or both. And he ended up dying. And another example was from a daughter of a 95-year-old gentleman who did make good choices. He was very health conscious, and the facility he was in, wonderfully had a gym for him to use. And then when the coronavirus mandates hit, he was told he could no longer work out in this facility, when it could have easily been arranged that he could work out by himself, not around anybody else. But he was, by the ridiculous mandates that were set forth and dictated by our governor, he was not able to do so. And then he went down quickly, both mentally and physically. And so anyways, my take that there's just not enough staff and training to help seniors and people with disabilities. And I think that could also go to the families of people that need more training and all that. And it sounds like something that you do. We were talking a little bit earlier about that, but encouraging able-bodied individuals to have a long-term care plan and to provide for their own retirement as much as they can. But I know if life happens, things go sideways. So we need to provide funding for our elderly and disabled who are in situations where they've fallen through the cracks. And because if we can help people who are arriving from other countries, we can surely help our own senior citizens. And they've contributed so much to our communities over the last. They've raised our families, they've built the businesses, and I think we can prioritize more funding for our seniors that are in our midst.
Okay, well, thank you for those informed answers. We've come to the end and the conclusion of the interview. So thanks, Kim, for carving out time in your busy schedule to take under consideration these important questions, because none of them are easy fixes. We've been visiting today with Kim Thatcher, who's the incumbent candidate for our State Senate District 11. We also want to thank all of you out there for joining us for this interview and considering your vote and hopefully including the needs of senior citizens and people with disabilities in that vote. Thank you again, Kim.
Thank you.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503 304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.